Good morning. We are going to talk about diabetes mellitus in pregnancy, and it is one of the commonest medical disorders. A midwife should be able to detect early and plan early for delivery in order to have good perinatal outcomes. So diabetes mellitus is a disorder of carbohydrate metabolism resulting from either deficiency or insulin resistance to insulin action, and it is characterized by hyperglycemia. Insulin is a hormone secreted by islets of Langerhans endocrine cells in the pancreas. So, trying to define this disorder of carbohydrate metabolism results from either one, lack of insulin in the body. That is when the pancreas is unable to produce insulin, or insulin resistance, that the body produces insulin, but the insulin produced by the body is either very small or inactive to metabolize carbohydrates. And at the end of the day, due to failure of carbohydrate metabolism, there is accumulation of glucose, which glucose, on testing of blood or urine, it will show as a sign of hyperglycemia. And this insulin we are talking about is the hormone produced in the pancreas by the islets of Langerhans. So, there might be a problem with the islets of Langerhans, that it is failing to produce enough insulin sufficient for carbohydrate metabolism, or it is not even producing any insulin due to causes we shall come across as we continue. So at the end of the day, the overall outcome of failure of lack of insulin, or failure of production of insulin, or non-active insulin, is failure to metabolize carbohydrates, hence leading to hyperglycemia and a condition diagnosed as diabetes mellitus. So, when we look at insulin itself, its function: 1, it controls the blood sugar levels. 2, insulin enables the tissues to burn glucose and store it in form of glycogen in the liver. So, those are the key functions of insulin: 1, to control the sugar, or being able to metabolize carbohydrates and metabolize it to turn it into more soluble particles called glycogen. So let us look at types of diabetes mellitus. One type of diabetes mellitus is insulin dependency, and it is called type 1. It occurs before the age of 30, and it is caused by failure to produce insulin due to destruction of the pancreatic beta cells, which are responsible to produce insulin. Insulin dependency, we are looking at the word dependency, that this patient is fully dependent on exogenic insulin, that her body cannot produce any insulin. That is failure to produce insulin. And what is the problem? The pancreatic beta cells may be injured either by disease, may be injured either by accident, or it may be injured by any pathological factors. And at the end of the day, the beta cells are unable to produce any insulin. So what does it mean? That this patient or mother is fully dependent on exonic insulin, and that is what we call type 1 insulin dependency, which is as a result of failure to produce insulin by the pancreatic beta cells. So here we are saying that the management of this is direct replacement of insulin, that this patient we shall be giving insulin directly. Then number 2, we have non-insulin dependent diabetes mellitus, and it is type 2. This is associated with obesity due to reduction in the number of insulin receptors. It is non-insulin dependent diabetes mellitus. So it means that this person is having diabetes mellitus, but this diabetes mellitus can be controlled by other drugs apart from insulin itself. And they are saying it is associated with obesity, and with obesity there is a number of this reduction of the insulin receptors. The cause is insulin resistance or failure of enough insulin secretion. Here the body secretes insulin, but the insulin it secretes is not enough to carry out all the metabolic activities per body weight to metabolize all the carbohydrate. But the body produces some insulin. So that is why this person is non-dependent insulin. It is due to just a reduction of the number of insulin receptors, and the cause is insulin resistance or failure of enough insulin secretion. Then we have secondary diabetes, which is type 2. This is caused by drugs like steroids, pancreatic diseases, endocrine diseases, or thyrotoxicosis. Here, in type 3, the pancreatic cells are damaged by things like the drugs. When we talk of steroids, basically we have the dexamethasone, we have the prednisolone. These are very dangerous drugs. And in these days, it has been noted that people have irrationally used dexamethasone in treatment of upper respiratory tract infections. But one of its very dangerous side effect is the causing of diabetes or predisposition of this patient to diabetes. So, if not drugs, it can be diseases that can come and affect the pancreas itself, or they can be endocrine diseases, that is, problems with production of hormones, or thyrotoxicosis. So this person will develop diabetes mellitus type 3, or we call secondary diabetes mellitus. Then we have gestational diabetes, which is usually type 4, and it is defined as any abnormality in glucose level noted for the first time during pregnancy. During pregnancy, the placenta and placental hormones separate and create an insulin resistance that is most pronounced in the last semester. So what we call diabetes mellitus type 4 or gestation diabetes, this mother has not been having any history of DM. But when this mother becomes pregnant, she presents with some signs and symptoms suggestive of diabetes, which we shall look at. And on lab results or lab testing, we are recognizing cases of hyperglycemia, either in urine or blood. For the very, very first time, the patient is not reporting any history of DM, but it is coming in when she is pregnant. And this is due to some physiological factors of pregnancy. And this is what we call diabetes mellitus type 4. They are saying it is most pronounced in the last trimester. So mothers who are at risk of gestational diabetes, why are we relying more on gestational diabetes? Because the other 3 types are common, that this mother may have been living with her DM. She knows the drugs, she knows her management, but this first time the mother is coming for antenatal, she's reporting signs and symptoms, and she does not report any history of having diabetes. So, after investigations, we find out that this mother is diabetic, or this mother is having hyperglycemia. So that is our most worry as regarding midwifery and the management. So who are these mothers who may be at risk? Those mothers who are over 45 years, overweight mothers, like we have said in diabetes type 2, mothers who do not exercise, mothers with history of blood pressures, family history of diabetes mellitus, a mother with persistent glycosuria, history of previous gestational diabetes, history of unplanned abortions, stillbirths and neonatal deaths, and mothers who deliver babies greater than 4 kilograms. So, just to give a simple overview, mothers reporting to being pregnant when they are over 45 years, a midwife should take caution. Overweight, we have talked about it, do not exercise. Mothers with high blood pressure, they are also prone to diabetes mellitus. A family history, that is why we always take a family history and we ask about medical conditions that transpire in the family. Persistent glycosuria, if this mother reports any history of having gestational diabetes, so this mother is also at risk. A mother who may also tell you that I have had abortions with no specific cause, spontaneous abortions, no specific cause, delivering babies dead, my babies are greater than 4 kilograms, that history, we take it during past obstetrical history. So, usually, we should take note that this mother may be diabetic positive.